Good morning, sir. You're still in mute, sir. Yeah, it's unmute, sir. You can talk. It's still in mute. Again, it went to mute.
Why?
And now you are fine, sir.
Okay, fine. Thank you.
Okay. Just to 5 minutes, sir, will be starting.
Sure, sure.
I hope participants are still in week off mode. Sunday.
Yes, today is Sunday, no?
Yeah.
Good morning, Mohanta sir.
Good morning, Mohan Raj.
How are you, sir?
Good, doing
Yes.
well.
Yeah, sir. Fine, sir. Sir, now in
How
Chennai,
do you-
sir?
Yes, now in Chennai.
Okay, sir. Okay. Yes, sir. So Ramalingam sir will be joining, sir.
Sure.
Few
sure.
minutes.
Hello. Good morning,
Good
sir.
morning, Prof. Ramlingam. Good
Sir, good
morning.
morning, sir. How are you, sir?
Good, doing well. Nice
How
to
are you,
see you all.
sir? And sorry, sir. Sorry for troubling you on Sunday.
And no. What is this is all regular our job. So
Sir, actually, what happened is because many of the participants throughout India, there are teachers taking online class, and
yes,
this 5 days program. So we expected that if you add the Saturday, Sunday, it will be convenient for them.
many of them. Yes,
Yes, sir.
true, true.
Yes, sir. That's what we planned such a way that in the 5 days program, this Saturday, Sunday is included.
No, that is good for everybody actually.
Yes,
Once
sir.
little they plan,
Sir. And so, how is everything, sir? Corona
uh,
cases at
uh,
how
it
is
is
everything,
coming down, but still we
sir?
have sizable proportion.
Okay, sir. Mm, sir,
But
sir,
Andhra is reopening, no? No,
yes, sir.
Telangana only is reopening.
Telangana, sir. No, Andhra not yet decided, sir. They have not
No,
announced it, but
yes.
and they are, we are all started conducting like with the minimum strength. PG and all we started, sir. PG and all we started for examinations. We started.
For Tamil Nadu, no college, no school.
Yes, sir. Tamil Nadu, they still.
No, because the positivity rates are high.
Yes, sir. Yes, sir. Yes, sir. Rates are very high, sir. And so everything's safe now, sir. It's fine now, sir. You know, in
Yes,
your
yes.
surroundings, everything's fine now, sir. Okay.
Fortunately,
Okay, sir. Mm.
because now if we are safe, nothing is better than that.
Yes, sir. That is true. That is true.
Because things are happening so fast, and sometimes without even giving little time to think.
Yes, sir. That is true.
We are 2 days before everybody is fine, nothing, and suddenly we come to know something has happened.
Yes, sir. That is true. Even, sir, even our pharmacy fraternity also, many of our near and dear we lost.
Yes, yes. Now we cannot find anybody whose
Sir.
close associates have gone.
Yes, sir. Yes, sir. Yes, sir. Yes, sir. Definitely.
Everybody, either relative or professional colleagues or some or
Friends.
other,
Yes,
we
sir.
have
Yes, sir.
lost.
Definitely, sir.
And that
Mm.
is why even I am thinking is
Yes, sir.
why can't in our curriculum we should now introduce the Disaster Management Act,
Yes, sir. That is true, sir.
because
You're absolutely correct.
we are teaching so many things in our pharmaceutical jurisprudence,
Sir.
and some of them are not at all relevant at this moment, like
Yes, sir.
Medicinal and Toilet Preparation Excise Duty Act.
Yes, sir.
This is in 2017 itself has gone.
Yes, sir. Sir, the many things, sir, which is not in the amendment now, which is lost, gone, even that is there in the current syllabus. That can be removed, we can be added new things.
Yes, my request to all of you,
Yes,
those
sir.
that Disaster Management Act should be introduced in jurisprudence.
Yes, sir.
At
That is
least
true.
if replacing the Medicinal and Toilet Preparation Excise Duty Act,
Yes, sir.
because
That is
this
true.
act is now
Yes,
merged with GST
yes, sir.
in 2017 itself. Moment the GST Act
Yes, sir.
came, so it is
Sir.
merged. But
Yes,
still,
sir.
we are teaching only Medicinal and Toilet Preparation Act.
Yes, sir. Yes, sir. Yes, sir. Okay. Mm-hmm. Okay,
And
sir.
like that, if you see, still our jurisprudence have Schedule Y.
Yeah, yeah, sir. Yes, sir. Yes, sir. Yes, sir.
Of course, thing is, we are
Sir.
at liberty to, for you, no problem, because it is autonomous.
Yes, sir.
And for other colleges, they are not
Yes,
able to change this.
yes, sir. Obviously, sir. They cannot, sir.
They cannot change it.
Yes,
And
sir.
the if the teacher is well aware of things and all, teacher is not teaching now Schedule Y, telling that
Yes, sir.
Schedule Y is no more relevant to us, and we are
Correct.
teaching the clinical trial rules.
Yes, sir.
Okay,
Good,
but what
good, sir.
happened is it is in the syllabus, and
Ah,
question paper setter is somebody else.
ah.
He will go by the syllabus only.
Yeah, yeah, sir. That is true. That is true,
And
sir.
so these are all some of the issues
Hmm.
we have to cope up as things move.
Sir, actually, what should be this? What we last time J into you we submitted because now PC syllabus come into the picture before, and in every core subject, the last one unit should be made as like current trend. So the current trend on particular topic, and that should change every year. Every year we should add what are things should be changed.
Yes, whatever is the unless we keep updating ourselves, both in
Yes,
the
sir.
curriculum as well as the teachers' ability to deal with it, and
Sir.
it is something like people make fun of our curriculum. You see,
Uh,
the 19 when we started our 30 years back education regulation.
yes, sir. Yes, sir.
So
And
like that, people start making fun of us.
That, yes, sir.
So you teach the subject of 1990
ah,
in
it really,
2020.
sir. For example, even this ICH guidelines, it was introduced in 1990s.
Which one?
But our people, students, the feeling is ICH guidelines are in 2020. It is recent guidelines.
Yes.
Hmm.
No, that
It
is
is.
some of our difficulties,
Yes, sir.
challenges.
Yes, sir. And sir, shall we move, sir?
Yes, I am ready.
Okay, sir. Okay. And good morning, dear participants. And sir, I welcome our heartiest welcome to you for our at AICT ATAL FDP on behalf of our institution, principal, and organizing committee. And I welcome you, sir. I welcome you for this online FDP. And Dr. Pawan, and you may please proceed. I think one of our sir, our faculty, Dr. Mohan Raj, will be introducing you to the speaker. I
Sure.
mean, to the participant, and the participant will listen to your sessions, and we already instructed, and they will interact with you at the end of session, sir.
No, even then and there also no problem.
Okay, sir. If you have no objection, no
I
issue, sir.
have no
Okay,
objection. They're all
dear participant, our speaker is happy to receive your comment even in between. Also, you can raise your comment, and we can ask questions. You can interact. Thank you, sir. Dr. Mohan Raj, could you please introduce Dr. Monda, sir?
Yes, sir. Yes, sir. Yeah. Very good morning to all the participants. On behalf of the organizing committee of ATAL sponsored online FDP on Pedagogue capacity building, excellence in higher education, I welcome all for the fourth day of the first section, and it is very pleasant for us, particularly the RIPER autonomous, the management and staff members, to have one of a stalwart in the profession of pharmaceutical sciences, with a person of eminence of nearly 36 years of experience, committed and dedicated for the improvement of pharmaceutical sciences in India. And good morning, sir. We are happy to
Good
have
morning.
you. And for the participant, it is very important to know the very achievements and accolades made by Professor Guru Prasad Mohanta, sir, one of a very eminent person. And I just highlight a few of his achievements of a very great extent. Why? Because it takes more amount of time to read sir's complete curriculum vitae. So I summarize sir's achievement. So Guru Prasad Mohanta, sir, a former National Technical Officer, World Health Organization Country Office for India, former professor and head, Department of Pharmacy, Annamalai University. Sir is having nearly 35 years of experience in teaching and research in the field of pharmaceutical science, research and education. Sir is having nearly 33 years of teaching pharmacy and 2 year committed to program management and administration as technical officer for essential drug and medicine in World Health Organization India country office. Sir was a former expert member, administrative and social pharmacy and ethics group of Federation of Association, Asian Pharmaceutical Association, a member of the National Level Advisory Committee, Government of India, for engaging community pharmacists in Pharmacovigilance Program of India, a former faculty advisor, International Society for Pharmacoeconomic and Outcome Research, ISPAR Student Chapter, a member, Board of Studies of Chalapati Institute of Pharmaceutical Sciences, Autonomous, a member, Board of Studies, SRM University, Chennai, former member, Board of Studies of PharmD Program, Rajiv Gandhi University of Health Sciences, former member, PharmD Review Committee, Pharmacy Council of India, former executive editor, Medicine Information Newsletter, Annamalai University, former member, Pharmacovigilance Cell and Pharma coordinator for National Pharmacovigilance Program for Peripheral Center. Former Chairman, Board of Examiners, PharmD Program, Annamala University. Former Member, Academic Council, Annamala University. Former Member, Board of Studies of Annamala University. Associate Member, International Society of Drug Bulletins. Vice President, Community Pharmacy Division, the Indian Pharmaceutical Association. Former Member, Pharmacy and Therapeutic Committee, Raja Mutaya Medical College Hospital, Annamala University. Former Member, Infection Control Committee, Raja Mutaya Medical College and Hospital, Annamala University. Sir is a member of Editorial Board of Rational Drug Bulletin, CDMU, Orissa, and advisory member, Odisha Pharmacy Intellectual Forum. Sir, to his credit, have a various number of research and projects funded and granted by regulatory authorities, national and international wide. Few of Sir's accolade and very exemplary research projects are notable. Number one, Sir completed World Health Organization funded project on estimation of medicines requirement, completed EPN supported infection control intervention project, completed antimicrobial resistant campaign targeting School of Children Ecumenical Pharmaceutical Network of Kenya supported program, completed Health Action International Asia Pacific funded project on antimicrobial use in public hospital as principal investigator, supervised ICMR Senior Research Fellowship for a project on bioavailability enhancement of albendazole for effective treatment of parenteral stages of human and veterinary helminthiasis. Supervised CSIR Senior Research Fellowship for a project on tumor-specific targeting of anti-cancer drug. And sir, I've completed project development of new erythromycin derivative under UGC and ICMR funding as co-investigator, medication error and rational drug use, medicine use status. To his research credit, Sir has 17 PhD awarded, guided by under him, and 4 are at working stages. To his research credit, Sir is having H index of 22 as on date June 15, 2021, and International Journal 128, National Journal 80, and popular articles with the very best citations are 314. Sir has contributed a personal column, Know Your Medicine, in fortnight supplement of the New Indian Express for 4 years from 2004 to 2008. Sir have authored various books. To his credit, Sir is having a textbook of pharmacovigilance as a principal author for What Everyone Should Know About Medicine, and author for textbook on clinical research, a guide for aspiring professional and professionals, and authored a textbook of forensic pharmacy for student and professionals, a principal author, handbook of medicine and pharmacists, co-authored Good Pharmacy Practice Training Manual of World Health Organization and CDSO funded project, co-authored a textbook of pharmacy practice and pathophysiology, and co-author of Oriya book on medicine use WHO CRO project, a principal author for physical pharmacy practice text, principal author for pharmaceutic practical manual, co-author of a booklet, A Career in Pharmacy. And Sir also co-authored a book of safe use of medicines, a layman's handbook, a co-authored of trainer manual for training of pharmacists of Odisha, co-author of a book, Responsible Use of Medication. And Sir has a radio talk on ORS and zinc and pediatric diarrhea, AIR, Puducherry. And he was a research person, a guest lecturer of nearly 152 in various platforms, both national and international. And Sir has attended international conference and working committee meeting of 29 and national seminars and conference of 60. To his credit, he is having an honor of the following. He is expert invitee to attend second international My Dispense Symposium 2018 at Monash University, Italy, and expert to attend the meeting intended for pharmacovigilance curriculum for UG education, recipient of IAPST Pharmaceutical Scientist of the Year 2015, nominated as expert, administrative and social pharmacy and ethic group of Federation of Asian Pharmaceutical Association, recipient of Best Researcher Award 2011 and 2012 Annamalai University, recipient of IAPHL sponsorship to attend 5th Global Health Summit.
Dr. Mohanraj, I think is enough.
Yeah, it is going on, sir. Maybe I think it is going on, rolling a lot and lots, sir. So, on behalf of the organizing committee, to the participant, we request you to spare your 90 minutes of time in understanding the expert and eminent personality, what is going to deliver, and update the educational aspect to improve the higher education. Forward to you, sir. Mohanta, sir.
Thank you, Professor Ramalingam and Professor Mohanraj for the invitation, and also the principal, Sir Professor Padmanabhan Reddy, and others for giving me this opportunity to interact with our young colleagues.
Yes.
Friends, things are changing every day. Can I share, Mr. Mohanraj?
Yes, sir. You can share, sir. You can share, sir.
So the option side to that hand symbol present now, you can use that for sharing, sir.
Pardon?
The symbol beside the hand symbol, there is one board type, no, sir?
Yes, yes.
Present
yes,
now.
yes.
That there you can use.
This arrow symbol, no?
Sir, that
Yes,
one.
sir. Yes, sir.
Is it visible?
Yes, sir. It's visible, sir.
Yes, sir. It is visible.
Just make it
Visible,
full
sir.
screen, sir.
Yes, sir.
Yes, sir, visible.
Thank you very much. Friends, things are changing, and unless we as a teacher do not change in students' mind, in society's assessment will become outdated. And that is the reason why we need to be updated every day. And I congratulate this ATAL FDP group because they have taken steps to educate all of us so that we'll be updated. Friends, I begin with two quotes, all related to education. Destroying any nation does not need the use of atomic bombs or missiles. It just requires the quality of education. Education is the most powerful weapon which one can use to change the world. So with these two famous quotes on education, and I'm sure we agree with the responsibility that we as an educator have for the society. Friends, this is a common discussion among the teachers, especially the young teachers, who always think when they were students, they were not like the present day students. Feeling is the present day students are not listening in the class. They are different. We are so obedient to our teachers, and the situation is changing. And we look little frustrated because we find students are often not cooperating with us. So why it is happening? Why this distraction? And why we have such a thought in our mind? So I believe this is because of the principle ask. All these days, what we have been talking is knowledge. And in society's view, teachers are perhaps the most knowledgeable person. Yes, that is true. But if we look at the knowledge at this moment, what is knowledge? Knowledge is facts and figures. And who knows about the knowledge now better than the Alexa or Google Assistant? They are definitely much better as far as the knowledge is concerned, the facts and figures are concerned, compared to the teachers. So that is how now the trend has changed. Initially, it was knowledge. Then we said, no, knowledge is not enough. We must have the skill. So from knowledge, we have shifted to the skill. Either the individual has the competency, individual has the skill to do. Then from skill, we have shifted to ask attitude. If one has the attitude, one can easily acquire the skill and the knowledge. So in terms of priority, it is the attitude which comes at the top. So this is the principle. And if we want to be a successful student, professional, anything, and this principle is valid. So developing attitude should be our first priority. If we have the attitude, we can have both skill and knowledge, and which are all useful for our success. And that is why this change is coming. And when this change is coming, we need to change ourselves as a teacher. Friends, in the learning metrics, all these days we have been talking, teaching, but now teaching is not important. Either learning takes place or not. So if we look at the various parameters of teaching learning process, we give now more importance to learning than the teaching. So in the learning, there are 3 steps: before learning, during learning, after learning. Yes, learning by the students, but who facilitates this learning? It is the teacher who facilitates this learning. So teachers are now the facilitator. So how a teacher has to behave, prepare himself or herself before the learning, during learning, and after learning, because teacher is facilitating this learning. Friends, currently if we look at, always a teacher has to prepare for the class, and preparation for the class is not what to teach. What the students should learn. So what is our goal? What is our objective? Objective is the students should be learning a concept. Students should be learning a skill. Students should be acquiring knowledge. So for that, a teacher has to prepare his or her goal, what should be the objective of the class. And this goal and objectives must be satisfying the requirement of SMART. What is this SMART? SMART means S for specific, M for measurable, A for attainable, R for relevant, and T for time bound. So our goal and objective should be set in such a way that it satisfies the requirement of SMART. So what we have to do during learning? So what we have just discussed is before learning. Now is during learning. Provide work-related exercise. That means keep them engaged through activities, exercise, so that the transfer of learning takes place. Give immediate and clear feedback. So as the student, now we have the system, something called the learning management system, LMS. And LMS now everyone should use. Some of the LMS systems are available free software versions. So that immediately a student don't need to wait. Help the learners to develop realistic action plan. Then conduct the evaluation of learning. So pre-course knowledge and post-course knowledge we have to define, and we should conduct an evaluation. Then for teachers, what about after learning? After learning, there should be periodic evaluation on learning outcomes. Friends, every syllabus now you will find there is a learning outcome, and so many outcomes are there, like program outcome, program specific outcome, course outcome, and we are all looking at the learning outcomes. So what the students have learned, and this is through periodic evaluation. In other words, we say continuous internal evaluation. There are 7 principles of good practices. 7 principles of good practices. Good practice, first one is, first principle, it encourages student-teacher contact. It encourages student-teacher contact both in and out of class. So it is not that we have completed our class and there is no access by student to the teacher. Teacher should be accessible both inside the class and outside the class, as well as even outside the college timings. Good practice encourages cooperation among the student. Cooperation among the students means they should be able to work together. So team learning is always more pleasurable. Team learning instead of individual learning is always encouraged. Good practice encourages active learning. That means what is the student so good practice encourages active learning. That means the students should participate. Students are encouraged to talk about their learning and also to share their experience and try to relate all those experiences with their past experience, that what they see in the society, how everything should be linked to it.
Sir, excuse me, sir. Sir,
Please.
sir, your slides are not changing, sir, in the screen.
Changing, no? Now only up to this, this is the first principle of 7 principles.
Okay.
3
No,
are
sir.
there.
Still, we are able to see only the
Only the
first
title slide, sir.
slides.
It's not changing, eh?
No, sir. They're not changing.
It is still the first slide, eh?
Yes, sir.
Yes, sir. Your title, sir, your name slide, sir. That's it.
Oh, what is to be done?
Sir, you can go for slideshow. I think you can stop sharing and once again you share it, sir.
Okay. Is it now sharing?
Sir, sharing, sir. Can you go to slide share mode?
Yes, I have done this slide. Is it share? Is coming?
No, sir. Once just move slides, sir. We'll check whether they are moving or not.
No, this is I am moving the slides.
They're not moving, sir. Still, the two codes are shown on the screen.
Still, so what I'll do is I will go out and come back again.
Okay, sir. Okay. Okay.
Okay. Or I am sharing this. Mohanraj, can I share it to your email?
Okay, sir. Okay, sir.
Eh?
Yes, sir.
I'll just put this to your email.
Okay, sir.
Is it visible, sir?
Yes, sir.
Just try to change the slide, sir.
Yes, sir.
So slide is visible, sir, but you can go for changing
Just-
the slide, sir.
Just move up and down, sir. We can see whether they're changing or not.
Mr. Mohanta, I have sent to your email also.
Sir, once again, I will check it out, sir.
That last mail you sent, no?
Yeah, sir, yeah.
Why suddenly? I don't know, something happened. Mr. Mohanta, you got it?
Yes, sir, I'm checking it, sir. Once again, sir.
Is my screen visible?
It's visible, sir.
But only thing I have to check.
Yeah, if you go to second slide, sir, now just go to second slide. No need to slide share. Just go to second slide, sir.
Yes.
Yeah, it's moving. Again, yeah, it's changing, sir.
So it's going, sir.
Yeah, slides are, sir.
So shall I put the slide share mode?
Sir, Mohanta, sir, please stop sharing once.
Yes,
I
sir.
think Mohanta, sir, is now good. Yeah. his
Okay,
slides are
fine,
sharing.
sir.
So this is okay?
Sir, once share again, sir. They are changing. Previously, they were changing.
Now, can I proceed or?
No.
I'll
Once share again. Once share again.
So stop sharing and coming back again.
Yes,
Yes,
sir. Yes.
sir.
So now it is not working, no?
No,
Not
sir, no.
working, sir. Not working.
Is it? Is it showing?
Sir, right now it is visible, sir. You can change the
Just-
slide, sir.
Go to it. They are changing, sir. Sir, present
Yes.
like this only. Don't go for slide share. Present like this only, sir. Because I think once you are entering slideshow, some trouble is coming. You can continue with this.
But it is visible to you, no?
Yes, sir. It's visible.
Okay, thank you. Sorry for the inconvenience little caused. So of the various, one is very important for us to give the feedback, quick feedback to the students, and the students to assess them, what they have learned, what they still need to know, and how to assess themselves. So this is also part of our good practices to sensitize them and educate them. Next is emphasizing the students to ask. Ask means, yes, we are asking them certain, giving them certain task, and these should be time bound. The task should be time bound so that the proper feedback can be offered. The good practices communicates high expectation. So expectation is high. That means our expectation as a teacher is high from the students, and so as the student expectation from the teacher is also high. So good practices respects the diverse talents and ways of learning. So the students may have a different viewpoint on many matters, and we should respect their views. We should discuss with that. And finally, self-introspection. Yes, there are teaching learning practices in the class, in the college, and what a teacher should introspect, self-thinking, self-analyzing. The first one is designing to facilitate learning. So what I am doing to inform the students. So when I go to the class, do I talk first what I am going to teach them? Or I just go and start, yes, aspirin, this is the structure and these are the reaction, how you should be preparing, able to synthesize aspirin? Or we give them an introduction that this is what I am going to teach today, this is what expected from you today, that you will learn this. When you can find out about the student expectation, do they like your paper? See, in our country, it is the course that is designed by the statutory bodies. There are some countries where the individual teacher decides about the course. Individual teacher decides about the course. And so people come. And that exactly happened when we have a value-added course. A teacher offers. It is up to the student to join or to join other teachers. So how do they like our paper? How do you build about the students' life experience? What students have gained experience over the time? So do we link our teaching to that? Just a small example here. We tell, we make our tablets. How the tablets should be used? Do we need enough water to drink after the swallowing of the tablets? If we are taking a liquid, this is all everybody uses medicine. So when we are taking even the liquid medicine, do we need to take water? Because, tablets we need because we need to swallow. Liquid is easily swallowable. Do we need to take? So bringing that, their experience. So for example, taking sufficient water, if you look at, if it is a tablet, we must drink enough water so that the tablets will dissolve. Dissolution should take place. Liquid, whether we should take, yes, liquid also we do need to take. Only one liquid we need not take, rather we should not take water after, that is the cough link test. Link tests we don't. So like that, anything we are teaching, try to link with their experience. How do you ensure that there is a consistency between the paper we are teaching, subject we are teaching, and the learning outcome? Are they consistent? Then self-introspection relating to the students. Are you concerned with the active engagement of the students? Sometimes we have diverse students. So how to keep them together and actively engage them? Do we have climate of mutual respect, trust, and open competition? Open competition means the students, if they have some ideas, their ideas are to be listened, their ideas are to be respected, and they should be encouraged. How do we indicate the student that you respect their values and beliefs? In what ways do you assess student reflect on the values they hold? What do you do to encourage student to become aware? This is all how we behave with the students. So if we behave properly with the students, we are concerned about their welfare, the students will definitely learn and they will have the enhanced regards to their teachers. So we do teach. The purpose of our teaching is the students should learn. So how do we do that? How do you show students you are enthusiastic of the subjects? See, it is not just teaching a subject, but it is the teaching, our involvement in the teaching, that the teacher, the students feel that my teacher is very, very enthusiastic about the subject. Not that we just go and talk something what a robot does. So our involvement with the subject, our competence in the subject, the way we speak with the students will definitely help the students to improve their interest, and it will also help to improve their learning. So here, friends, here is a small exercise. We know aspirin. So in the class we are asking how to make a aspirin formulation. So what formulation? Either we should go for solid or we should go for liquid. Yes, obviously all of us will go for solid, but we have to think why solid. So that is how we want the students to think, students themselves to find out why solid, why not liquid. Because perhaps it is the solid which is stable form, and liquid, aspirin, acetyl salicylic acid, undergoes hydrolysis, becomes unstable. So if we want to go for solid, so we'll make formulation as tablets. So which one we should go? Dry granulation, wet granulation, or direct compression. These are the three options available to us. So what we say is the students should logically able to think and decides. Friends, I quote The method of preparation they select is their choice. So whether they will do solid, they will go liquid, it is their choice. But how they are going to select, that is mine. Means that is the teacher's job. Teachers has inculcated, teachers has infused the systematic way of approaching to the formulation. Then we have a different concept, the problem-based learning. It is not just the lecture we give. So the question here begins, these teachers should stop lecturing, start asking. So what are the steps involved in problem-based learning is introduction of the problem, search for facts and ideas, brainstorming, address learning needs, final briefing, and solve the problem. Friends, it is very, very difficult to sequentially follow all these things. For example, if we are taking a class, we told them the problem. Now they have to search for facts and ideas in order to solve the problem. And I am not sure how many colleges we allow the students to use the smartphone in the class. So if we allow the smartphone to use in the class, they will be able to come out with their ideas and we can brainstorm and discuss and finally solve the issues. In general, of course, the PharmD classes are little easier because the number of students are restricted to 30 and only in the 4th year and 5th year it is 40. So it is easy to handle, and the students, if they are using even the smartphone, we can encourage them. So here again, friends, the problem solving, and I take mostly the pharmaceutics problems because this is my subject. So if we have to formulate an antacid product, which one is preferable? Should we go for a solid formulation or we should go for liquid formulation? If it is liquid formulation, should you go for solution or suspension? So here, see the solid or liquid, let us look at patient's point of view, the therapeutic effectiveness point of view. So if it is liquid, it quickly neutralizes the excess acidity. Solids, it doesn't do it because it requires time to interact, whereas in the liquid, they are all suspensions because these are the insoluble solids. All the antacids are insoluble solid except your sodium bicarbonate, which is usually discouraged. Otherwise, they are all insoluble solid, so suspension. So we have to, it doesn't mean that we don't have solid. We do have solid. But when to use what, that should be our thinking. So friends, here again we have an activity, because when we talk that we should teach student-centric teaching learning process, I also have taken some of the problems so that we can discuss how the activity can be conducted. For example, here, if we teach ORS, so what are the teaching points we should teach? Can I ask some of you to put in the chat box? if we want to teach ORS, what irrespective of the subject concern. Okay, let us see what we should teach. Then plan for a problem-based learning. So we'll see how we can improve the learning now. So definitely we need to teach how the ORS is made. Oral rehydration salt. It contains the sodium chloride, sodium citrate, potassium chloride, and anhydrous glucose. This is the formula. Now, while teaching this ORS, do we teach why this is the combination? And if we look at earlier books, including the pharmacopoeias, we'll find a different formula. And why we have changed the formula? Why we have changed the formula is to maintain the osmolarity of the solution. To maintain the osmolarity of the solution. So, osmolarity of the solution, when we talk of osmolarity, it is the concentration of the solution, colligative properties, concentration of the solution. What we always believe, more concentrated, more potent, more effective. More concentrated, more potent, more effective. But if we see our formulation ORS, we have reduced our concentration. The quantities per liter of solution, we have reduced them. Because if our ORS does not have proper osmolarity in the gastrointestinal tract, there is every possibility that the reverse will take place. Instead of absorption of water, we will have release of water from the cells. Osmosis, we have seen. What osmosis says? The liquid or the solvent moves from the lower concentration to the higher concentration. And if our ORS is more concentrated, more loss of water will take place from the cell to the gastrointestinal tract. Instead of more water absorbing from the gastrointestinal tract to the cells. So that is why the formula is revised. And here key point is the appropriate quantity of the ORS and the appropriate quantity of water. Friends, again, there is pharmaceutical jurisprudence, another subjects, and we have mostly the pharmaceutics teachers teach, though anyone should teach this pharmaceutical jurisprudence. So what to teach? For example, let us take a Drugs and Cosmetic Act and the rules. This is the subject matter. Do we teach anytime the role and responsibilities of the central and state government? Because it is not clearly mentioned in the Drugs Act. Drug Act, it mentions so many things. We have to extract it. What are the powers of central government and what are the powers and what are the combined responsibilities? Friends, Narcotic Drugs and Psychotropic Substance Act and the rules. We know Drugs and Cosmetic Act fall within the jurisdiction of Ministry of Health and Family Welfare. But when it comes to the Narcotic Drugs and Psychotropic Substance Act and the rules, under which administrative jurisdiction it falls, we never teach this, because none of the book has very clearly written about it, and the act does not tell. So we also don't teach. You will be surprised, the main ministry involved here is, though it is a interministerial material, the main ministry involved here is Ministry of Finance. In pharmaceutics or in physical pharmacy, physical pharmaceutics, one of the criteria is students determine the solubility of a substance in different solvents. And what is the procedure we follow? Procedure we follow is make a saturated solution and determine the concentration of the saturated solution, and that is the solubility. So how do we know whether it is a saturated solution? We say the set the solvent and solute together, and where solute will be in excess of its solubility. That means always there will be some undissolved solids. Then we say it is a saturated solution. But this is all by shaking. We say nothing is going beyond this. But by shaking, we cannot tell that solution is saturated, because nothing is getting more dissolved. So here what is the key is, we have to tell the students it is a saturated solution if you have periodically, if you see after shaking that there is no change in the concentration. After 10 minutes, 15 minutes, 30 minutes, there is no change in the concentration. If there is no change in the concentration, we say this solution is saturated. Coming to the pharmaceutics, many of you might have, those pharmaceutics teachers are involved. Preparation of weak iodine solution. We prepare aqueous iodine solution. We tell the students you should have iodine, you should have potassium iodide, you should have water to make the aqueous iodine solution. And why we are using potassium iodide? Because iodine is not soluble in water. In order to increase the solubility of iodine, we use potassium iodide. But friends, in weak iodine solution, iodine is soluble in the solvent. Iodine is soluble in solvent. Solvent is usually alcoholic solvent, alcohol. So when iodine is soluble in alcohol, still why we have the potassium iodide? So this is the question we don't teach them. Friends, this is all about, we talk about the teaching learning, and the learning we usually assess through assessment. We assess through assessment. So here is a question before you. Here is a question before you. Is it visible? The question is visible?
It is visible, sir. Yes, visible, sir.
So can please this is the answer given by a student, and how much mark you are planning to give him or her. So what is the question? A person wants to put carpet in the drawing room, and the drawing room size is 25 into 15 meter. The cost of the carpet per square meter is 200 rupees. So if a person wants to carpet this room of 25 into 15 meter size, what could be the cost of the carpet? I'm not talking of the labor cost and all. What should be the cost of the carpet, or how much you have to spend for buying the carpet? Look at the first part of the problem. The first part of the problem is, what is the area of the room? So length and breadth, the student has multiplied and made this 375 square meter. Then the second part is the cost. 1 square meter is costing 200 rupees, and 375 square meter, how much it should be. So he has multiplied 200 into 375, and this is the, so here the candidate, the student writes 7,500 rupees would be the cost of the carpet. Do you agree with this question and answer? And how much mark you do give? At least few, please. How much marks we can give?
Sir, one of the participants, Rakhi Sharma, said 19 in the chat
Want
box.
to give 90? Okay, very good. Very good. How to see the chat box here?
Sir, side there is a box type, no sir, at the bottom right.
Yes. I have come
Chat
there.
with everyone.
Yes.
Sunil Gandhi said 10. Alpana Gupta saying 19.
Yes. Very good. So 19, 10, 19, 19, 19, 20. Friends, what I wanted to tell here is this is a mathematics question, arithmetic question. In that arithmetic question itself, some you said is 10 marks at the lowest level, I find, and the highest level I find 20 marks. So for students, if the valuer who gives 20 mark is blessed, my paper has gone to the teacher who is giving only 10 marks. So is it my fault that I get only 10 marks, whereas my fellow friends, students, he or she got 20 marks? So this is our assessment problem. See the variation. Where 10 marks and where is 20 marks? What is the variation? And if such situation comes in the assessment for an arithmetic question, what will happen? Variation in a questions which require a descriptive answer. See friends, here is another question for you as a teacher. You have asked the students, normally they do sometimes 2 practicals in a pharmaceutics practical regular class or even in the examination also. You have asked them to dispense 100 ml calamine lotion. You have asked the student also to dispense 100 milliliter milk of magnesia. You know, in general, nobody completes one and then makes the other. Simultaneously they make, and they make the label also and fix. But what happens is, the student has interchanged the level, because always students will be in a hurry, completing, confused. So how much mark will you give? The levels are very good, they are neat, legible, accurate, attractive. I think accurate, maybe as well as the level is concerned, probably it is accurate and attractive, but interchanged. So when the level is interchanged, how much marks we would like to give? I'm sure you will find a lot of variation in our thought process. So what we assess? We assess knowledge and intellectual skills. We assess the communication skill. We assess the practical skills. These are the 3 important parameters that we assess. So what is this knowledge and intellectual skill? Recalling of facts and procedures, interpretation of the data, or the problem solving. Though we don't at each point consciously evaluate, no, we just holistically evaluate a student's performance. Friends, now the questions are usually in theory question papers. You have a multiple choice, you have short answer, you have long answer type. These 3 categories of questions are now advocated. The teachers have been advised to make questions accordingly, and some of the universities, the multiple choice question is a must, and it is really difficult to frame a multiple choice question unless a teacher is involved in that subject. So what we have to do while looking at the multiple choice question, keep the stem of the question short and clear, and use a complete statement, not just a single word. Make each question independent of the other questions. Avoid negative statement. If negative, please underline, so that student will not misunderstand the question. Avoid none of the above. You must have all the 4 answers. Avoid using clues that might suggest the correct answer. Use plausible or logical distractor. Make detractors or correct responses fairly similar in content or length. Arrange numerical values from large to small. So we are writing A, B, C, D multiple choice. So always values should be in a sequence, either from small to the large or from the large to the small, if the answer is a numerical value. And when these are the values, and where not just the numerical figures, but with units, we must write units in every case. See, here is a question. Which of the following defines the ipratropium bromide's mechanism of action? We have not here given none of the above or all the above. We have very specifically written the mechanism. So this is how the MCQs are to be made. Short answer questions should be reliable and economical. Economical means one should not write more. Test the student's ability to recall information without any clue. Test certain higher level problem solving skills. So these are short essay type questions. Like the examples we give or the guidance we give, keep the question short and clear, demanding a short, precise answer. So the terminology usually suggested is identify, compare, define, calculate. For example, so our question very a student, our questions will be very clear. For example, sometimes we use the word pharmaceutical marketing, pharmaceutical promotion. So are they same or different? So our short essay question can be compare these two terminologies, or how do they differ from each other? And very important here is, before conducting the examination, we must define the scoring procedure. And always it should be, it is not that one teacher decides, maybe in sometimes we take the opinion of our teacher, other teachers also, how to score, so that especially this is required when we go for university examination, where large number of students from different colleges, their papers are available for valuation and different teachers are evaluating. Yes, so the short answer question type is name the following features. So here, yes sir, will be done. 11:30 will close, sir, don't worry. So how it should be, no, directly you write, give the mechanism of action of ipratropium bromide. What are the indication of this drug? So like that it should go. How it should be administered? Very clear. And when we talk of long answer types, it should be either making a summary, making a synthesis, comparing two phenomena, and so on. So for long answer type, we have different types of verbs we use, and in general for question paper setting, level of questions, here see the lower order cognitive question should be 50 to 60%, so that an average students can answer them, pass the examination. Then we have 30 to 45% intermediate order cognitive question, and 15% should be of higher order, where a student has to think and answer. Friends, here again, just take the multiple choice questions how we should prepare forensic pharmacy when we are assessing the students' learning on drug price control order. Again, here, friends, still our books, many of them have not revised, and we find all those things. The forensic pharmacy books still talks of the earlier days of drug price control order, how the price fixation is done. So unless we look at the drug price control order, we'll not be able to properly frame the questions. So friends, it is very important our assessment is accountable. Since it is accountable, we are answerable. See here, blunders in evaluation. 1,200 teachers facing penalty for inappropriate evaluation. One more very important, friends, we need to take care of ours. We have so many issues because we have been talking constantly to the students and we exposed to the chalk, dust and all. So it is very important we need to take care of ourselves. And my last slide is thank you everybody for your understanding and patience, and take home message is if the students do not learn the way we teach, then let us teach the way they learn. Friends, it will be very nice if you have any question, if you have any feedback, share.
Sir, good morning, sir. Mohanta, sir.
Hey, please. Sir, good morning.
Good morning, sir. How are you, sir?
Good, doing well. Morning, I could not see you, but I told our...
Yeah, Ramalingam. Ramalingam.
Yes.
Sir. I had gone out, sir, morning.
Yes. So, participant, you are all our colleagues only. Yes. Today I am in this site. That is my privilege. And on many occasions, I am also like you on other sites, because attending the FDP is a important consideration in career advancement. Attending FDP is a consideration for NAC and NBA accreditation requirement. So we do have to, and we do also definitely, most of the time we get benefited, but sometimes we may not have it because of frequency may not match and all. It happens.
Sir, feedback form is not accepting any responses, sir.
So, Mr.
Please hold on. Please hold on. Please
Pawan?
hold on.
Pawan,
Just message, sir, message chesna, sir, group lock 2 minutes, sir.
Okay, fine.
Participant, kindly wait for it. The feedback link will be shared. Please. If you have any queries, please ask Mohanta, sir.
Friends, if you want to ask little beyond this, what we have discussed today also, but don't ask me science, because science I find is very, very difficult to explain, and also because one needs preparation to explain the science. But any other, including your area, if you have any question, I am very, very happy.
अरे तुम अपने मेल करो, मेल का गाइडेंस का कुछ आया होगा उसको वो करो, उससे ना सर्टिफिकेट डाउनलोड हो रहा है.
Participant, please check it now. It will be working.
Any question, please? Still telling it does not accept, Mr. Mohanraj?
Sir, it will work. Sir, it will work, sir.
Participants, the feedback link is working right now.
Geeta.
You can access it. It is working right now. It is functional.
Just a rectangular box దాని చుట్టూ ఎక్కడి నుంచి వైట్ బ్యాక్గ్రౌండ్ మొదలైందో సర్టిఫికేషన్ కి అది లాస్ట్ సర్టిఫికేట్ అయిపోయే ఎండ్కి మధ్యలో రాని లైన్ ఇన్స్టెడ్ ఆఫ్ లైకింగ్ పుట్టింగ్ ఎట్ ద ఎండ్ మధ్యలో వస్తే అది ఒక బార్డర్ లాగా ఉంటుంది కదా. ఓకే, అది పెట్టు. ఒకటి నువ్వు డిజైన్ చేసింది పెట్టు, ఇంకొకటి బ్లాక్స్ లాగా అక్కడిక్కడ పెట్టావు కదా.
Sir, what is your daughter doing?
పైన కింద రెండు బ్లాక్స్ పెట్టినట్టే
Sir, younger or elder?
Elder who was doing Farm D.
Yeah, actually, she was doing
పైన కింద కొంచెం
Venkateswara College of Pharmacy.
ఎక్కువ పెట్టావు.
Now she has resigned. She is taking 6 months old.
Sir, not audible, sir.
Sir, earlier she was working with Venkateswara College of Pharmacy.
Okay.
Now she has resigned and she is taking care of her
This is looking good.
child, little child, 6 months
Oh,
old.
okay. Yes, yes.
This is looking good.
She is mother of a son or daughter?
ఇది 4
Daughter,
బ్లాక్స్ ఉన్నాయి
sir.
కదా.
Daughter.
బ్లాక్స్ కొంచెం పెద్దగా చేయొచ్చా అంటున్నా. మరి అంత చిన్నగా ఉన్న బదులు అక్కడే సెంటర్ లో ప్రతి సైడ్ కి సెంటర్ లోనే ఆ బ్లాక్ ఇంకా కొంచెం ఎక్కువ రైట్.
Somebody is talking something.
Sir, she's been muted, sir.
Any queries from participants, please? Mohanta sir is waiting.
I think there are no queries, sir, but all are saying that really very informative session. Thank you, sir. Thank you, sir. The session helped us to retrieve a lot of information. Thank you.
Pawan, you just scroll down back. If any questions, you check it and put forward.
No, sir.
Yeah.
Okay. I
Anyway,
think Sar is introduced in between only, right?
Yeah. Thank you for valuable explanation and informative advices.
So my last thing that I would like to thank once again to every one of you, and my sincere request, I don't say it's an advice, to my young colleagues, you have to go a long way, so please take care of yourself.
Thank you, sir. Thank you very much.
Thank you, sir.
And
Thank you very much.
Don't restrict yourself that you are a teacher lifelong, you have to become a teacher. You can be much beyond that. You can be much beyond that. So I myself is an example giving. I have not studied pharmacy practice. I have not studied public health. I studied pharmaceutics. I studied pharmaceutics, but I have a great satisfaction of working in public health because I have it is my own interest, and I could go to the level where I can work for the country. So there is no limit for you. It is all your interest. Number one. Number two, friends, nothing restrict ourselves. Now the government of India is also recruiting on many occasions who are not the IAS or other administrative officials. They are even from the academy. They are coming directly to the level of joint secretary. So if we have the passion, we have the interest to serve the nation, nothing is a barrier, nothing is a limit for us. Thank you once again.
Yeah, rightly said, sir. Thank you very much, sir, for joining with us.
I think Sar is in mute.
So is it okay now to leave?
Yeah.
Yes, sir. Yes, sir. Thank you, sir. Thank you, sir.
Thank you, sir.
Thank you so much.
Thanks a lot, sir. Thanks a lot.